I was born with a terminal disease. It's called malignant curiosity. I can't stand not knowing the why. I came out of the womb asking why. And I just don't think we're doing people a favor if we just keep passing them along to the next specialist along the road and never come up with the reason why the body's reacting the way it is. So I have found myself going down many rabbit holes, which has kind of ostracized me to my colleagues in medicine. You know, most of the doctors in this valley, and I've only been here since 2011 practicing, kind of think I'm strange because I do things differently. I look at the body differently, I examine differently, and I think differently. You know, I actually grew up in special education. They thought I was mentally retarded until I was in 6th grade because I couldn't read, write, or do math, but I was the best athlete and the best artist, you know, in the school. So after painting the entire school and winning the California State Art Contest, where we actually got drug around Mr. Reagan's office because of the stitchery that I helped the class do, I finally demanded that I be tested after watching a news report on dyslexia. And so I think differently. I reason differently. I don't see the world the same way because I've had to modify the way I'm in the world because I have a crazy brain. My brain puts things all over the place. And sometimes it's hard to find it, but it's always there. So it creates creativity and malignant curiosity. So I'm a little bit different than most doctors, you know, and usually I'm hiding, trying to fit in. But in this way, it served me and many of the patients. So that's why I see mold, is that I kind of look from a different perspective. And being misdiagnosed my whole life, you know, where it really mattered, you know, I was never part of any group. I know what it feels like to be sitting on the other side of the desk, you know, being looked at, and nobody knows what you have. So I think I come as a different package of a doctor. So we're going to talk about mold. Again, I found mold through Lyme. And even though I'm open-minded, I'm the biggest skeptic I know. So everything that I'm doing, I would have said hogwash to years earlier. So it's really kind of funny that I'm doing this weird practice of Lyme and mold and other things, when in fact, it is the missing link in medicine. I am pretty convinced that because mold is multi-systemic, it affects so many systems of the body, people find themselves in different specialist office. You know, you're in the neurologist, you're in the rheumatologist, you're at the orthopedics, you're at the pulmonologist, you're at the renal doctor, and nobody is pulling the lens back big enough to see the whole pattern. But it's kind of like this. It's in everybody's face, but they can't see it because they haven't been taught this pattern. Once you see the pattern, you guys are probably the best diagnosticians in the community because, you know the pattern. You can see it, you know, when you're talking to friends at a picnic and say, I think I know what you have. And they've been to 20 other doctors, you know. So once you see the pattern, you can't not unsee it. And that's what I think I would love to be able to share with other doctors, but they tend not to be asking these questions. So, chronic inflammatory response syndrome. This term was coined by Dr. Richie Shoemaker, and it is what happens to the body when, in fact, people breathe in mold spores that become mycotoxins. And the reason not everybody is sick from that is because it's a genetic disease. You have to have the genetic predisposition that your immune system doesn't identify these neurotoxins, which come from the mycotoxins, as foreign invaders. So they stay in the body because they're not tagged for excretion. Normally, the body would tag these mycotoxins, say, hey guys, we got to get these out. The macrophages, I'm going to show you a little, it's 24% of the population actually is affected by this condition of the immune system not being able to identify the neurotoxins. And I call them neurotoxins, they're mycotoxins, but the reason Lyme and mold are found so oftenly together is they both create neurotoxicity. So they affect the body in the same way. So the symptoms are very, very similar. So we can have two people living in the same house, and one is incredibly sick, and the other one is fine. And it's usually the female in the house because it affects the endocrine system so drastically. And women are cycling all month, even after menopause, we're cycling. And so we actually have more symptoms than the men do. So I think we have now been responsible for 3 divorces in the practice, because it's usually the guys that don't believe that the wife is really sick because he built the house and it's fine. And that's a very common scenario. So here's your kind of PO'd macrophage. These are the white blood cells that grab bacteria and viruses, antigens, and they pull them inside themselves and they spit out a bunch of histamine and other chemotactic factors. And they send all this through the liver, and then if you have a normal immune system, the liver puts it in the bile and out it goes through the feces. That's normal. That's the 76% of the other people. People who have mold, does this work? See these little arms? You can't see. Anyway, these little arms, and then the catcher's mitts at the end of the arm. That is, does this work? No, that doesn't work either. Okay. That's what the people who have mold illness are missing. They don't have the arms and the catcher's mitts to identify these mycotoxins as foreign. So they stay in the body and they build up and they cause all kinds of inflammatory disease. Okay, don't have a little, mini panic attack looking at this slide. You can't even read it. But what it's basically showing is what happens in the body, this cascade of processes that happen when somebody who has the incorrect HLA types, the genetic effects, either you're multisystemic or mold systemic, when you breathe in the mycotoxins, that you guys, because they're not tagged, will go straight to a nerve cell, either the dendrites or the axon. That will make its way through the leptin receptor, which is the hormone that the fat cells make when we eat, and it goes to the brain and attaches to the leptin receptor, and that shuts off our hunger. That receptor gets toxified. So it's not an uncommon story for someone to be exposed to mold and gain 30 pounds in 2 months, doing nothing wrong, nothing different. It gets to the hypothalamus, which is here. You can't really read that. And these very, very powerful chemicals that the body makes to control the nervous system, the autonomic nervous system, your heart rate, your blood pressure, vasodilation, gastric emptying, all these things you don't think about. That is what the hypothalamus and these neuropeptides are doing. With the mold, you drop your MSH, melanocyte stimulating hormone, and when that drops, you have all these different things that happen. I'll read this over here so you can actually see it. Maybe I can see it. I can't see it there either. What's that? Oh, no, it's not. No, so it's sleep disturbance, chronic pain, gastrointestinal problems, chronic illness, and the list goes on. Immune suppression, cortisol drops, that's the chronic fatigue that is so common in the mold population. Chemotactic factors go up, cytokines go up, and the upper part of that is vascular endothelial growth factor, which when it's low in mold, so it's cutting off the vascular supply to your tissues. It's cutting off capillary beds. And so you get early exercise fatigue, your muscles burn, you can't breathe, and it affects the lungs and the breathing. So it's affecting the nervous system, the endocrine system. It's causing massive inflammation of your joints and your muscles and your nervous system. So it really creates quite a big a mess in there. And that's why it's in everybody's specialty, but nobody's seeing it as a big, broader entity that it is. So what's going on here? What happens when a building gets water in it? Well, any interior water damage to a building can grow toxic molds and cause CIRS, C-I-R-S, chronic inflammatory response syndrome. There can be many possible sources of these toxic compounds found in water damage buildings that can lead to a variety of the symptoms caused by mold illness. No single compound can be identified as the sole cause of the inflammatory response or the illness itself. seen in affected patients. No one thing can be deemed solely responsible for the sickness. It's actually the water damaged building itself. And 50% of the buildings in the United States have some sort of water damage. I beg to differ with that statistic on this side of the Mississippi. I cut my teeth in California. I just have been here since 2010. I've been doing Lyme since 2004. I don't think I saw mold in my practice. I think maybe one patient that I could not help get all the way better, probably now thinking back had mold, but it wasn't as common as it is here. Here we have older buildings, older homes, farmhouses, 1800 built homes. They're great, but they've taken a lot of hits weather-wise, and basements leak and roofs leak. And I think in my patient population, I'm seeing, I would say 95% of the homes that my patients are living in have some sort of water damage, because it's mostly at their house and it can also be at their workplace, i.e. schools. Okay, so another definition, just kind of to drive it home, is the chronic response syndrome, and due to water damaged buildings, is defined as an acute and chronic systemic inflammatory response syndrome acquired following exposure to interior environments in a water damaged building with resident toxic organisms, including but not limited to. So we have fungi, bacteria, actinomyces, mycobacteria, endotoxins, dander from pets, and insect droppings, as long as viruses. So it may not just be mold, okay? There's a lot of things in the buildings that once they get wet, they start emitting all this milieu of inflammagens that we start reacting to. So again, it's a multisystemic illness. It affects, the most common symptom is this profound fatigue. You can't sleep enough, you can't rest enough, you wake up exhausted, you run out of energy in the day. It affects the respiratory system, the gastrointestinal, neurologic, musculoskeletal, visual, endocrine, psychiatric. This can cause all kinds of mood disturbances and behavioral problems in adults and kids. Dermatologic, renal problems, urinating a lot and frequently, sleep disturbance, weight issues, and auditory problems with your hearing. So it's getting us in all kinds of places. So are there any, okay, we heard one parent from Cave Spring. Is there anybody else here because of schools? No? Yes? Okay, several. Okay, so we do have a target audience. When I was putting this together, I was reflecting, I see a lot of middle school and high school kids. Many I've had to take out of school because they couldn't process and they couldn't get better in the school environment. I don't see a lot of children, and I'm wondering, and I'm a family practice doctor, so I'm trained to see kids. I'm wondering, why am I not seeing kids? And I think because they're showing up with respiratory, illnesses. They go to the pediatrician, they get more antibiotics, and they might get better for a while, but then it comes back. And if they're still in the, so it's just this chronic revolving door at the pediatrician. And I don't know if pediatricians, like all the other medical specialties, are really appreciating this. There are studies that show chronic recurrent sinus infections are 98% more mycotoxins than they are bacterial. And yet we're going to give them antibiotics, they're going to get better for a while, and then it's going to come back and they're going to get more antibiotics. So, we kind of need to think about what the heck we're doing. But I see kids, I see a lot of kids for Lyme, and I work them up for mold, but they're not presenting with mold symptoms. And I think that's kind of curious. So the symptoms you're going to see in a child when you get to see one, they're going to display the chronic fatigue. You can't get them out of bed. You can't get them to school. It's a war in the morning, to get them off and get them going. They want to nap. They want to go to bed early. And you think they're lazy, okay? They can have recurrent headaches, chronic abdominal pain, frequent diarrhea because it actually causes leaky gut, brain fog, sinus problems, allergies, chemical sensitivities, the allergic salute, constantly, rubbing their nose up to try and get their secretions out of their face. A lot of the chronic illness that we see in the respiratory, section in these kids is probably due to mold. The other piece is, we all say when you go back to school, both the teachers and the kids all get sick because they're all sharing each other's viruses, that they weren't sick on the outside in the summer. Guess what probably is going on? They're probably reacting to the mold in the schools that have been closed up all summer long, and the air is not flowing. They're not air conditioned. I've had teachers come back and tell me that their easel, where they left a tear paper white board, was completely filled with mold on the back cardboard, growing about an inch long. And she had to go back into that classroom. And she was one of these reactive people. So I see a lot of teachers, and they're sick. And what are you going to do? You have to go back to school. And a lot of the schools don't want to deal with this because it's expensive. We see dermatologic, all kinds of rashes, even skin sloughing. Respiratory symptoms, cognitive dysfunction. These kids can't think, they can't process, they can't retain their information. Neurologic abnormalities, it causes serious peripheral and autonomic and cognitive dysfunction in the whole spectrum of people, no matter their age. So it really gets in the way of learning. They have a hard time learning. And peripheral neuropathy, numbing, tingling, going numb, feeling like creepy crawlies are running up and down their skin. Visual problems. It causes blurry vision. There's actually a visual contrast study or test that we can do online to actually see if we have biotoxin disease. So it can cause visual disturbance. And the endocrine dysregulation is huge. We see little boys not developing as they should, delayed maturity, and we see little girls, because some versions of mycotoxins, some species are actually estrogenetic, and so we see little girls developing at 5 and 6 and having their period, and it can be due to mold. In my adult population, women tend to have all kinds of menstrual dysregulation, and they tend to bleed heavily and often, almost like they're in perimenopause. And that can be into the late teens and early 20 age group. So when I see a woman at that age bleeding a lot, coming in for hormone balancing, I immediately think about mold because it's a clue. Okay, what is the first order of business if you think you're being exposed? You got to get out of the exposure. You cannot get better if you're continuing to breathe this stuff in. It is relentless. The treatment is not difficult in the regard of complexity, but it's hard to do because you have to detox like 3 times a day on an empty stomach, and that's hard. And you're not going to get better if you're still breathing it in. So you got to get out of the exposure. That's why I've had to take a lot of kids out of school. Because we just couldn't get anywhere with them being in school. These are the symptoms in adults. I wonder if we could focus that a little bit better. Anyway, I could read through these. They're vast. We've already mentioned many of them. But the group on this side is like dementia. A lot of patients come in thinking they have early dementia. So it's memory issues, focus, concentration, word recollection, decreased learning of new knowledge, confusion, disorientation, mood swings.
Can I pull this back and I'll make that bigger?
Yeah, that'd be great. All kinds of cognitive disruption. And this is actually part of the Alzheimer's picture. Oh, that's better. We can all read it. Okay, perfect. But again, the top one is fatigue. So if anybody, I think this is one of the underlying unknown reasons why people have chronic fatigue and fibromyalgia. I don't buy those 2 diagnoses. If somebody comes in and says that, it's like, okay, let's go down and fix that. Because it's many things together, and it's too complicated for Western medicine, who has 7 minutes to spend with you. Yeah, it's not going to happen. So weakness in the muscles, aches, muscle cramps, joint pain, morning stiffness, peripheral neuropathies, Tremors, jerks, fasciculations, like your muscles are, little worms underneath your skin. Headaches, super common. Light sensitivity and sound sensitivity. Red eyes, blurred vision, visual changes, tearing, sinus problems, cough, shortness of breath, sweats, diarrhea, abdominal pain, just like the kids. The memory issues, skin sensitivity, like these people cannot be touched. Their nervous system is so on fire. Excessive thirst, because that effect on the renal hormone that is not allowing you to concentrate your urine is causing you to drink a lot. So you're peeing a lot, you're drinking a lot, it's very dilute. That's actually diagnosed as diabetes insipidus. That's water diabetes, not sugar diabetes. And a lot of patients have it. Temperature regulation due to the thyroid. The thyroid always gets dysregulated, and you can have a totally normal TSH, which is we're all trained in medicine to look at your TSH. TSH has nothing to do with what your free T3 is doing, which is the actual thyroid that's running your body. It's like, I use the analogy, it's the gas in the tank, and the TSH is the dial on the dash. Have you ever run out of gas thinking you still had gas? It's kind of the same thing. You're out of gas, but it doesn't look like it. Appetite swings and excessive weight gain due to the whole leptin process. So this is from our favorite friend, Dr. Campbell. It's the mold is the gun, but it's the mycotoxin that's the bullet. Okay, it's the one that kills you, and it actually can. It's very dangerous. Okay, history on this. This goes back way back to the Old Testament. If you're a biblical scholar, Leviticus chapter 14, it was the plague growing up the walls, the stones in the cave or your home, that they had to wash down, get all your stuff out, try to reintroduce it. If it happened 3 times, they had to take the house down. So they knew about this. They knew you had to get out and take nothing with you and walk out naked. Egotism is what it was called in the Middle Ages, and it was also St. Anthony's fire. So why now? Why are we seeing so much of this now? It has to do with the changes in our environment and the changes in our homes. Suburbia sprang up in the 1940s when all the military guys came back from the war and started making lots of babies. This was the origination of the baby boomers. And so building materials changed. We went from plaster lath walls, which didn't grow mold, to wallboard, which is basically paper. And drywall is a chocolate sundae for mold because it's made of cellulose. Any wetness that happens and it stays wet for 24 to 48 hours is going to start to grow molds. So when you get something that gets drenched, say your water heater leaks or your ice maker breaks, you got to get that up and you got to get it dry. Otherwise, you're on the road to disaster, possibly. Spores will go in the air and then they create the mycotoxins. Mycotoxins actually kill bacteria. They are nasty, nasty little things. Fleming, who was the one that discovered penicillin, the way that happened is he had 2 petri dishes that he inoculated, one with mold and one with bacteria, and set them next to each other on his lab table and went on vacation for 2 weeks. And when he came back, the mold was all big and happy and lovely, and there was no bacteria in the other plates. And so that's the origin of penicillin, because it was a penicillium mold. So that's kind of nasty. And other things that get going on once we get wallboard and other building materials wet is VOCs, volatile organic compounds, which has everything to do with all the binders and the glues and all the other things that the wallboard is made with. So all that gets released into the air. So this is kind of showing what mold looks like. That looks awfully like the pictures I saw in the news from the mothers at Cave Spring. The 4 mycotoxins that we're concerned with are the trichothansines, the aflatoxins, ochratoxin, and gliotoxin. And we can actually test, do a urine test to see if these are in your body. It's expensive, and only Medicare covers it. But it is possible to see what actually is in you. Leaks happen. Refrigerators, under the refrigerator, behind walls, basements flood, crawl spaces without vapor barriers. I am not an environmental toxicologist or a construction person, but I've had to learn a whole lot about how things are made and where they are and how to prevent them. So that's a plastic barrier over your dirt basement so the moisture doesn't get into your floorboards. Toilets, tubs overflow even once. If it drips through, your kitchen sink from the bathroom above and it's coming through your kitchen light, that's a problem, even if it happened once. Bathrooms aren't vented, okay? This is just gonna kind of grow creepy mold on the walls. And flashing is a huge problem. Even in new construction, sometimes the flashing is into the wall versus away from the wall. So, people argue, it can't be my house, it's brand new. Well, there's problems with brand new houses. This is kind of a morbid slide, in the background, of course. Mold is one of the worst thing that can happen is mold is a very potent DNA synthesis inhibitor, meaning it can actually cause cancers down the road by altering DNA synthesis. The other piece is it really suppresses the immune system. We're making cancer cells all the time, and our immune system's keeping it at bay and checked, and everybody's fine. But you put these two things together, immune suppression and alteration of the DNA, and you can have cancers developing, years down the road. And this could be going on in our schools. It's going on in our homes. Molds have been weaponized. They're the strongest and most potent gas attack, volatile substances they've come across because they affect the nervous system, respiratory system, GI, urinary, and cause skin sloughing. So the most potent is aflatoxin 1b, and that's what they've been using on the Kurds and in Syria and all that, because it's an immediate killer. Go ahead. Yeah. Okay, I love this slide because it's not just the kids, it's also the teachers. And the problem with schools is, the contracts go to the lowest bidder and they cut corners, right? They all cut corners. So we're not really protecting our kids that have to go to these schools and teachers have to teach there. Dawn, we had to pull her out of school early because we couldn't get her better as an ex-teacher. How to tell if your child is affected by mold? Well, the symptoms, okay, that list of symptoms that, and it's usually upper respiratory, but not always. I mean, they can have no upper respiratory symptoms at all. They have aches, they have pains, they're fatigued. It could look like Lyme disease, but it actually could be mold, and often it's both. Because I think they collaborate. I think you can have Lyme, your immune system is keeping it at bay, you get exposed to mold, and then you lose that battle. And then you get affected by both. The history, when did this happen? Did it happen, moving into a new space, a new exposure? We do a lot of cataloging where you lived when, kind of thing, or what school you went to. And then laboratory evaluation. What's really nice about mold versus Lyme is that I can trust the mold markers on my labs. It's like a regular doctor. I don't have to intuit what's going on because everything is normal. It actually tells us. We have long-term markers and short-term markers. And so I can tell you, are you being exposed right now and you have for a long time? Or are you okay now, but you've been exposed for a lot longer in your history? And we can start detoxing you before we have to pull you out of school, change your house, fix your house, spray your house, whatever. And then the VCS test is pretty reliable of age 8 and above. It's kind of like a little computer test for kids. They can do it. Not super young kids, but age 8 and above. And that's testing visual acuity. On the computer, it's a $15 test. It's on survivingmold.com. Dr. Shoemaker's website. And we use that kind of as a test, to help the diagnosis. And also when we're done, okay, the person has to fail the test initially. It's a 92% sensitive and specific test. So it's gonna find it 92% of the time. So you can have a false negative, you can still pass and have mold 8% of the time. So we have people take it initially, and if they fail it, we use that after the first 3 months of of treating them to see if they eventually pass it, before we go running all these labs again. But these are the labs that help us get to the bottom of it. MSH is a long-term marker. It actually shows if you're being exposed to multiple antibiotic coagulase negative organisms in your nasal passages and sinuses, which is dropping your MSH. C4a is an acute inflammagen, and it goes up in the first 3 days of a new exposure. TGF-beta, MMP9, VIP, these are all long-term markers. VGEF, that helps us decide, do you have mold or do you have Bartonella, which is a co-infection of Lyme. Bartonella raises that, mold lowers it. So sometimes that's the only sign we have of Bartonella on board. And if they have both, they're in the middle and they look normal. I've had people who treated one and all of a sudden their Bartonella went crazy. Because Bartonella and mold have exactly the same symptoms except for about 4 things. So they're hard to separate out by just, symptoms. I look for leptins if there's been a weight gain that's unexplainable. And then the HLA-DQs, that's the actual genetics. We can actually test your genetics and find out who you are in regard to your sensitivity to mold. And then antibodies, which our labs can't run here. I've tried. Dr. Campbell talks about that, but we can't run those in this area. They can't seem to do it. But that would be helpful. But it also, if you're having immune suppression and you're checking antibodies, it's kind of like Lyme. Lyme decreases your immune system. So we go and check a Western blot, and we think it's fine if it's normal. Well, you're testing an inaccurate and inadequate immune system. So this is what the genetics look like when we plug it into the computer on the website on the computer, your little genetic numbers. And this is actually a patient of mine who's probably my most challenging at the moment. He has the dreaded 4-3-53 genetics. He is multi-susceptible and mold susceptible. So he is in deep, deep doo-doo. This is a really tough case. He also has every heavy metal, mercury. He's not had a good gut since age 5. Yeah, he's like my worst person right now. But we can run these genetics and we can actually see what your susceptibility is if exposed. And that does help us quite a bit. I love this. I wish we could get that a little bit tighter. This is a great chart. This came out of the Townsend letter, July 2014. It shows 3 of the 4 mycotoxins on the left, and the mold species, it's too much. Come. Oh, okay. And the mold species that actually make those mycotoxins. So if you get a mold test, you're going to have on your test all these crazy things, aspergillus and penicilliums and stachybotrys and all these others that are hard to pronounce. Those are the species that make the mycotoxins to the left. And then examples of the binders are in the middle column there. And we have all kinds of different binders that help bind these neurotoxins, bind your bile, which your immune system has not tagged for excretion, and they get reabsorbed. And what's interesting about this is that cholestyramine, which is the only medication on that list from the pharmacy, it's the only one that's actually been studied by Dr. Shoemaker in tests and research. It only binds ochratoxin. It totally misses trichothansine and aflatoxin. So we actually don't use that, and it's very hard on the gut. It causes gas and bloating and all kinds of things. I am actually using zeolite and glucomannan, which are here, and they're in all 3 categories. So you're not going to miss anything by using those as the binders. And then to the right are all the potential food sources that these mycotoxins end up with before they hit our stores and tables. They're stored in a raw state in granaries, and they get moldy before they even get to us, and then they get mixed into food, and then we eat them. And there's controversy whether oral taking them in orally is going to cause this Sears chronic inflammatory response. I think, like with any allergen or any antigen in your body, the more it builds up, the lower your threshold to react to it. So I really think foods make a huge difference on this. Okay, treatment. What is the treatment? We kind of just went over that. The first thing is get out of there and don't take anything with you if that's possible. And a lot of times it's not possible. You have to get yourself away from the exposure, whatever that takes. Remediating your house, spraying it with the Green Home enzyme, Green Home solutions, we use them a lot. This is not a plug. It's just that's the easiest, simplest, cheapest way to eliminate all the mycotoxins in the space. You have to detox. You have to detox using the binders. You have to help your body detox in saunas. And we use some homeopathics and hot Epsom salt baths and whatever you can to sweat and eliminate to get this stuff out of you. These are all the binders that are available. Again, I'm currently using the glucomannan and zeolite. And then mold creates a biofilm in the nasal passages and in the sinuses. And it hides behind that. And that could be a source of chronic infection. So we have to use biofilm busters. Claire Labs has EDTA in their product. It's an interface plus enzyme. And then whole leaf stevia is what I recommend if the person is also co-infected with Lyme, because it's the strongest biofilm buster we've come across. And this is not the refined stevia you buy in your grocery store. This is actually the whole leaf, and it's a tincture. It's in the Petri dish, it's the strongest biofilm buster, and it kills Lyme directly. So it's kind of a twofer. And then xylitol spray, I start with that. It's an alcohol sugar. Goes by the name of Xlear, and it's 4 sprays each nostril twice a day to get at the Marcons. There's about 10% of the people that we have to get to higher level treatment of the nasal passages, but that's where we start, because we used to use something that was a lot more caustic, and people were calling with bleeding noses, and they wanted to take our name in vain, and so we changed it. Yeah, but sometimes it doesn't get it all. So that is what mold does to your body. It's pretty nasty. And if we're knowingly exposing our kids and our teachers to these environments, knowing what it's going to cause later on, it makes no sense to me. It's really a hard nut to swallow to think that we're going to send these kids back in the fall and they're going to be, exposed to this stuff, and Band-Aids are going to be put on. There's all kinds of problem with every kind of mold testing, whether it's air, tape, ERMI. You can poke holes in any kind of testing for mold, and it can be kind of bastardized by the way that the airflow in the building's running at the time. They compare the indoor to the outdoor, and if a bunch of airflow is coming in the indoor from the outdoor, they're going to look the same. So how can anybody be sick? The molds that grow inside a space are not in an ecosystem. Okay, outside they're in an ecosystem, so they keep themselves in checks and balances. Indoor, we don't have that. And so the toxic molds that we have actually created since the 1970s, Pittsburgh Paint put an antifungal in their paints. It sounded like it would make sense. Benamil. We also started spraying it in all kinds of fields. And we actually created supermolds in the interior space and outside. And so the ones that have sort of taken over in the interior space have nobody to predate them. So they go nuts, and they're making us sicker and sicker. So that's all I have as far as my presentation, but I am here for at least another half hour if you guys want any questions asked. I'm not a toxicologist. I'm not a building inspector. This would be medical questions. I'm learning that piece kind of reluctantly because it's not my world. But this is another one of these rabbit holes that you come and you find how many people are affected by this. It's absolutely phenomenal in this area. Questions?